good evening. I'm so thrilled to be invited to make a contribution today, and I'm overwhelmed, totally overwhelmed with what I've heard so far. I'm a nurse, long before I was a politician, and I'm a nurse now. I'm no longer a politician. And my goodness, my sisterhood and brotherhood of the nursing community across the world, I applaud you all. We have today, 15th of November, a population survey. And the population of the world is now over 8 million people. That's increased dramatically in the last decade or so. And there is an international conference taking place in Thailand at the moment on the world population. Why would we do this? Thank you. Why would we be involved in world population and family planning? Because it's critical, absolutely critical to our futures that we have planned families. How do we do that? Well, we educate girls. How many girls are uneducated? Half the world's children. In 2022, half the world's children still don't go to school. So we've got a lot to do. And I want to compliment my friends and former Prime Minister Gordon Brown and his wife Sarah for the work they do in bringing education for all. I sat in the United Nations when I was privileged to be a minister for the Millennium Goals. And it was the Millennium Goal that by 2015, all children would go to school. Education is critical to us all, and it's critical to save the planet and to save our health system and to regulate our health system, educate our health system, and to be alongside every one of us nurses and medical staff where there is an obvious shortage of people entering healthcare, staying in healthcare. In the UK, that's exactly the same. We have, as we would call it in the UK, a real incident of lack of resources to care for people. Of course, I can't compare that to what I've seen today, heard today, and what I know of exists. I spent years as a community nurse, having done all sorts of critical care work. And why did this nurse, why did Anne want to go into politics? Well, in the 80s, in the 1980s, the UK was in a recession. And it was a serious recession. And I was going to visit elderly patients whose hips had crumbled with arthritis, whose eyes could not be seen, they couldn't have vision because of cataracts. And they were very unwell, and they were cold in the United Kingdom in the 1980s and afraid to put their heating on. And I found one of my patients, a bit of a namesake of mine, Annie, she was one of my favorites. I know we're not supposed to have favorites, but she definitely was one of mine because she kept saying, oh, it's all right, nurse. I'll be okay. I can't afford to pay for the heating that I know you'd want me to have. So I'll be all right. I'll be all right. And I found Annie dead. Like many of you will have no phones. I had no mobile phone, and there was no phone in the house. And I remember going down the road to look for a phone box, which we have in the UK, in a way still have, where the public can use telephones. and I had to get an ambulance that way. Within a few days, another one of my patients, equally, I found was dying. And I could see the breath, my own breath in the house, because the house was so cold. And I knew then I could not fix this. Politics would have to fix this. And it took a long time for me to see my struggle to become a member of Parliament, to sit at the back of Gordon Brown when he was Chancellor, raising all of the money that people of that age group would need to keep warm. Sadly, we are going to face in the UK similar situations again. Now, extreme heat, extreme cold, and floods, and the whole of the climate change argument, along with the population rising in most countries, in China and India in particular. We need to say, who can help change this? Who do we want to see sitting alongside sometimes, and I'll be the first to admit, some of the most useless politicians I've ever come across. Politics should be about moving people forward. It should not be about doing harm. And we know, don't we? All of us, wherever we are listening to this, we know there's a lot of harm done by politicians, whether that's war, ignorance on what's happening to our climate. And we the healthcare professionals, we the nurses, have to cope with their decisions that are sometimes for the greater good, but for sometimes not for good. And of course, we see that with so many wars taking place around the world in the name of either religion or power. Where are we in this? Where are we? I say we're a soft power. Every one of us, people that's contributed today and will continue to contribute, we don't know each other, but we do have a bond between us. We have a very, very special bond between us because we know how difficult nursing is, how the emotion that we have to have and the power of our strength, physical strength, and the knowledge that we have to have, and how we feel when we can't use any of those things. We have a bond. We would only have to look at each other and know that we understand. Oncology, how do you go to, I've got a slide where there's people, which we saw recently from the Pakistan presentation. We saw, how do you get to those people? As a district nurse, I sometimes struggle to get to my patient, but only because the area I was working in at the time had snow and the roads hadn't been cleared. So I had to open the boot of my car, put my Wellingtons on and a shovel and just move some snow. Quite simple, really. We were able to still get to our patient, to the much needed medication that was involved in their end of life care and pain control. Pain control, wow. How do you control pain in floods like we have seen? How do you give care? So where's our voice? I really worry that we're not involved at the level that we should be, at every level, really. We are one of the most trusted professions in the world, nurses. So why aren't we involved in the decision-making? And some of you may be, and I'm not aware of that. But I think we all could be and should be, Because if it's not us, who will do it? Who will put the voice of the power of the nurse? Because we do have power, soft power, yes. In conflict, we're soft power. We treat everybody with the same respect, or at least we should. No culture, no religion, no sexual orientation, no discrimination. We are diverse. We're a diverse group, but we're much more than that, aren't we? I was struck when I was given the honor of a fellowship of the American Academy of Nurses. The American nurses have always been involved with senators. The Speaker of the House, Nancy Pelosi, has always had a nurse in her office, in her team. The reason being, they know how knowledgeable they are. They know how resourceful nurses are, and they know who to turn to when there's such a gap of inequality, real inequality. And I'm hoping to bridge some of that gap within my work within the Labour Party today. And the reason why I'm determined to educate the politicians on nursing is because they don't know how capable we are. They don't see the work, and they don't know of the knowledge that maybe is sometimes very unused that we have. Hence the title when I discussed it with Annie. What can I say? I'm not an expert on climate change. I can't give you graphs of what's going to happen, and I can't pretend to be that expert. But I'm part of a group of nurses that have gone that extra road to say, hey, I want you to listen to me. I want a seat at your table. It very often said, if we're not at the table, the chances are, well, obviously our voices would never be heard. But we really, really need to make sure every one of us at the end of this conference day should say, how can I, as a nurse, represent the population I serve in health within the decision makers? Because I don't believe we are treated as the decision makers. We're there to, with the rescue team. We're sent out to do our best in a rescue situation. And we know that climate change is affecting oncology. I know from my own husband had a diagnosis of lung cancer, never smoked, was a fit man, refused to give in to not playing soccer and played it into his 60s. He was fit, but he had lung cancer, very well developed by the time he was diagnosed. When I asked the oncologist, do we see more of this in urban areas now with pollution? Oh, yes. He said, most definitely. Non-smokers are getting lung cancer. Other cancers we know of that are caused through climate change. And the developed world now, the big conference taking place again on COP27, isn't it? It's, should we pay and help pay for countries that have never polluted like we have? Should we offer them financial support? Big argument. Oh no, well, it's, you know, it's not our problem. Refugees coming to my country, the United Kingdom, aren't always treated as they should be. What would we do? What would we in the United Kingdom do if we were suddenly flooded, if we knew we were at a risk of danger from civil war, from the disease that brings about such changes? I know what we do. We would want to look after our family. We would want to leave. The world's refugees are going to increase because the climate change is not going to go away. Please, nurses, wherever you are, whatever speciality, do
Dear
your
John,
utmost. Do your
now
utmost
you're
to make a decision and be involved. Thank you.